Hi everyone, I'm Claire Nixon and I'm the Newcastle Safeguarding Adults Board Coordinator. The board is made up of agencies who all work together to ensure that adults with care and support needs are protected from abuse and neglect. I'm here with a couple of people from those agencies who continue to work hard to keep people safe.
Hi, I'm Julie Brown. I'm a Safeguarding Adults Manager. I work for Newcastle City Council's Safeguarding Adults Unit within the multi-agency Safeguarding Hub. My involvement with Safeguarding Adults is to coordinate the Section 42 inquiries so that when we receive a concern, we commence investigations to try to reduce or remove the risk to the individual.
Hello, my name is Alan Cairns. I'm a Detective Chief Inspector with Northumbria Police. I work in the Child and Adult Protection Department. My job is to oversee investigations in relation to vulnerable children and vulnerable adults.
Thanks both. So we know that some people might be at increased risk of abuse or neglect at this time. What are the types of concerns that you're seeing reported in at the moment?
So from a social care point of view, we're receiving reports of increased stress and tension within the family home because people aren't able to get out. So we're seeing a lot of domestic abuse, whether this be physical abuse, verbal abuse, or even a person who's got care and support needs, that being neglected. We know people with care and support needs are particularly vulnerable to domestic abuse anyway, so we're concerned at this current time. We're also getting referrals about people not looking after themselves, for example, not wanting to seek help for a health condition or the care they might need.
Yeah, Claire, in relation to the police, we are seeing a number of concerns at the moment. Some of them concern increase around antisocial behaviour, which can be noisy neighbours, breach of regulations, drinking or drug abuse within the home, and this can have a negative effect on residents and neighbours, but it leads to issues with people who are living in the same household as antisocial behaviour perpetrators. We are seeing an increase in relation to online frauds and scams, and what we're seeing with the current restrictions are that many criminals are seeking to use the lockdown as a reason to target people in the home. They'll target vulnerable people in the home and on the doorstep. It may well be that on the doorstep they're offering to do jobs, say for example jobs around the house, jobs with shopping, and what they're looking to do there is exploit people to try and get money off them. We're seeing an increase in online frauds and telephone frauds where people may well be receiving phone calls from persons who are pretending to be from organisations such as banks or the government or the police even, or departments which may well engage with cash transactions, and these frauds are often trying to target people to part with money or part with security details. And we're also seeing an increase in frauds in relation to telephone contacts. Again, it's trying to get personal details or trying to get cash out of people. We're also, we've seen an increase in relation to or we are concerned about neglect in the home. As Julie mentioned, families are cooped up together, and this can lead to tensions, can lead to family arguments, and the potential rise in domestic abuse. So, we are very concerned that people in the household may be targeted in relation to those crimes.
Thank you. So, when you get these concerns in, what might you do to help keep the person or other people who are at risk safe?
From a social care point of view, when we receive the concern that someone is at risk of abuse, it's our job really to speak to a lot of different people. We gather information, we're piecing together a jigsaw, we're deciding what can be done from a multi-agency basis to protect the person. Because we're working with adults, we always like to speak to the person at risk. We want to find out from them what's happening. We'll be guided by them as much as possible. If the person's unable to represent themselves, then we'd always try to speak to family, friends. We'd refer to an advocate. It's really important to us that their views are represented in the Safeguarding Adults process. We work really, really closely with other agencies, with our colleagues in Social Care Direct, really to try to get the person the help and support they might need. This might be doing things like arranging care for them, getting support for the family, for carers. Carers are feeling particularly stressed at the moment, ensuring that the person has food, that they have medication, helping with accommodation issues. We're working really closely with our NHS staff and services to ensure that the person's health needs are met, including making sure that, you know, people get the treatment that they need, or that they're having the appointments that they need, even if those are delivered in a slightly different way at the moment. We're ensuring that the person's needs are met in that way.
Hi Claire, in relation to the police, some of the things that we might be doing, we may well get some of our safety planners involved, who can look to make sure that victims of crime can have a plan in place, to work with them to make sure that they've got some of the basics there, so that they know how they can get help in an emergency, check that they've got suitable communication devices so that they can access help, check that they know who to call, and check that they've got a little bit of a plan as to how they can make themselves safe. If there are concerns about an address or someone who is suffering abuse and neglect, we can refer to our neighbourhood officers, who can put extra patrols in place and do extra check-in and make sure that we're aware of problems. We'll work with partners, as Julie said, for example, in relation to housing services, to make sure that we're joined up and that we know sort of which tenants have issues, so that we've got a joint plan in place. And you know, we've got a lot of restrictions in place in relation to COVID-19. However, police investigations still continue, and we are still taking action against people who are perpetrators of abuse, and we're still there to help victims of neglect, to make sure that we can help them, put support measures in place, and that offences are thoroughly investigated. Where there's domestic abuse, we make sure that we refer people on to support services. And I know that we'll come on to give some details later in the conversation. But in relation to victims of fraud, we have got a number of partner agencies who can help and support. If there is a report of fraud, would make sure that if it's reported through the 101 number, that will give suitable advice on the telephone. We refer to Action Fraud to take a report of fraud. And what we'd ask is that people are alive to this, and we've got a number of organisations that we do work with, and we'll do release those details on our website.
Thanks. You mentioned, Alan, that professionals are working differently at the moment, and there is less face-to-face contact with people. So we're really relying on the public and volunteers to be extra alert to vulnerable people and those who are at risk. If somebody's worried about a family member, friend or neighbour, what should they do?
Yeah, we rely in any event on people to look out for one another, be it friends, families, neighbours, workers who attend people's homes, such as carers, even delivery workers, or workers who are sort of going about, going in the streets, who are coming across vulnerable people. And whenever anyone has a concern, we'd ask for them to report it to us. There are a range of mechanisms. If it's an emergency, if you need immediate help, we'd always ask people to dial 999 and ask for the police. But if it's not something which is needing an immediate response, you could dial 101 and ask to speak to Northumbria Police, and you can report and discuss a concern that you have on the telephone. We've got the Northumbria Police website, which is very easy to use. And you know, when you open up the website, there's a tab there to report an incident, and you can discuss and you can report a range of concerns there. and if the police pick that up, we'll either deal with it directly or on occasion we'll make sure that our partners get notified of concerns as well.
From an adult social care point of view, if someone's not in immediate danger, they can report abuse or neglect to adult social care by telephoning 0191 2788 377.
Okay, thank you both. That's been really helpful. We really want to emphasise to people that even during this time, we're here to help people who are vulnerable and who are at risk. So if people do have a concern, please report it.